this week in Virginia, and I'm just outraged. It was appalling. It didn't have to happen. It could have been prevented. And what went on? Well, State Senator Craig Deeds' son was in jeopardy, was in psychiatric jeopardy. He brought him into a hospital. He was assessed, and guess what they decided? They decided he needed emergency psychiatric care. But the hospitals were full. There was no bed. So guess what they did? They sent him home. Yes, they did. They sent him home. Now, can you imagine the scenario where you go in there and they say to you, hey, you're having a heart attack, but guess what today? We're busy. We're full. Go home. Come back in a couple of days' time and we'll look after your heart attack then. There was no way in the world they would do that. No way in the world. What this means is very simple. There's one standard for psychiatric diseases in America, and there's another standard for physical illness, and it's appalling. So then what happened? The young man went home. His name is Austin Gus Deeds. He allegedly attacked his father, the state senator, stabbed him multiple times, and then sadly blew his own brains out. Blew his own brains out. Now, we don't know the full circumstances of that event. We know that the state senator is in hospital and he's stable, and we're glad that he is stable. It is a tragedy all around. There's no question about that. What were the alternatives that day? What could they have done that they did not do? And I'll tell you what they could have done. They could have kept him in the ER for 24 hours or 48 hours until a psych bed became available. They could have admitted him to a medical bed with a chaperone, somebody to watch over him, somebody to sit beside him, to make sure that he didn't harm himself or others. Those are kind of very basic things. And when you think about this, have this thought. This is a state senator and his son. Do you think that the people looking after him didn't want to do the very best they could? Do you think the people looking after him didn't realize that if something went wrong, there's going to be a lot of hullabaloo about it? You bet they did. You can bet they did, but he was sent home. Can you imagine how the rest of us would be treated if we went in there? So how did we end up in this appalling situation where psychiatric services are really middle-aged? They're awful. How is that? Well, it's a long journey down on the downward slope. Absolutely long. And part of it is based on the HMO insurance. When they came in, they promised all kinds of stuff. We can do it much cheaper than everybody else. We can do it better. We can do the same things everybody else is doing for a fraction of the cost. Well, this is what they did. This is how they cut their costs on psychiatry. They withheld payments. If a patient had to go into hospital, they said, we're not going to pay for it. We're not going to do that. Even if they're severely mentally ill, we're not going to do that. Or at most, we're going to admit them for 24 hours and that's it, no matter what happens. Now, doctor, you make the decision because I'm just an insurance man. I'm not the doctor. I can't make that decision, but you can. You can make any decision you want. But keep this in mind, if you admit him, we're not paying. If we admit him, you don't get paid. And if you admit him, the family are going to get a big bill. So guess what happened? Well, people didn't get admitted. It's that simple. And then they decided that in their infinite wisdom, but keep in mind that they're not doctors, they decided that drugs were better for most psychiatric conditions than psychotherapy. Yes. And this is against all the evidence. So that's why so many people ended up on anti-anxiety pills, antidepressant pills, and they refuse to pay for psychotherapy, even though, for instance, in anxiety, there's no doubt whatsoever that talk therapy is way better than pills. No doubt whatsoever that cognitive-based talk therapy is the best thing you can do to treat your anxiety. And I understand that some people will need pills in addition, but that's the basics, that's the core. That's like you come into me with asthma and I say, you know what? We're not going to give you the basic drug, albuterol and asthma, because we're going to do something else. It's absolutely and utterly ridiculous. And here's the other thing that really exacerbates me about this. If you have somebody and you think they're a danger to themselves or others, and you say to them, will you promise me that you won't do yourself harm or other people harm? And they say yes. The HMO say, hey, you can't admit him, we're not going to pay. He has a contract with us, he's going to obey the contract. How reliable a contract do you think that actually is? Really? How reliable do you think that is? But that's what they want. So what was the net effect of all of this? Well, the community health care centers, which was the backbone of mental health care in the United States, was overloaded with patients that they couldn't cope with. Their funding was cut back on the public side, and then third-party insurers, all the people like that pay us, that pay all the insurance, that we give money to, are supposed to look after us, they weren't really giving them enough money to survive. They weren't giving them enough money so that they could actually do their job. So they went bankrupt. And where was the American Psychiatric Association and all this? MIA. Missing in action. Not doing anything. You know, they had conferences about the latest diagnostic manual, what should be included, what shouldn't be, how many variations of autistic disorder exist. They weren't out there in the trenches, screaming and fighting and kicking for their patients where they should be. And here's my final pet peeve in all of this. If you come into me in my office and you have severe asthma, diabetes, whatever it is, and I feel that you need to go to see a specialist about that, I make the referral for you. If I think it's urgent or stat, like it's got to be done very, very quickly, I actually call the physician and say, hey, I've got Juan here, or Esperanza. They have a lot of problems. Can you see them, blah, blah, blah. This is what I'm worried about. And they go, sure, Joe, I can see them. And they give us a time. In psychiatric referrals, doesn't happen. I can't make the referral. You, the patient, have to make the referral. Yes, you do. You have to look at the back of your health insurance form where it says 1-800-mental-health hotline. So try explaining to somebody who's got bad anxiety that that's what they've got to do. They've got to call that number themselves. You can't do it. Your nurse can't do it. Your assistant can't do it. They have to call that number, and they have to make the appointment. Now, say I see 20 people over a 3-month period with severe anxiety that I want to go to have psychotherapy. How many of those people do you think actually call that number? Even if I have persuaded them, tried to make them understand what the problem is, how many do you think actually do that? Very, very few. And that's the whole idea. Because the insurance company will make money if the patient doesn't get treatment. If the patient doesn't use the service, they get money. Because keep in mind, they already have your money in their hand. So when they spend some out of it, there's less in their hand. So what they want to do is spend less. Think about it. And those of you out there who hate Obamacare, and I know I get all the emails, I know. But at least he brought in a Bill of Rights. A Bill of Rights that gave you certain protections, certain minimum standards that they got to have when you give them their money. You're listening to Dr. Chambers on Call. I'm live in the studio here every Saturday morning. Whatever you want to chat about, not necessarily what I'm chatting about today. If you have a question about your health, 888-539-2980. That's 888-KFWB-980. Remember, whatever is on your mind about your health, you can call in. That's 888-539-2980. This is Dr. Chambers on Call on KFWB News Talk 980.